I've been in the ED and I've seen a lot of like EKGs put on, but just can you kind of just go through that a little bit more and what you saw as the main problem? I know just like how that process goes, and I know we've talked about it too. It's just in the fact that it hasn't changed since it started.
My focus was, I think most people watching an EKG being done, if they haven't seen it being done, would probably ask themselves, really? Is this 21st century technology? And I'd be walking into the room, you have a critical patient, they're sweaty because they're having a heart attack, perhaps, at least you think they are, and we're trying to get an EKG, and we just can't get these stickers. The normal process for an EKG is we put 10 electrodes on your body, 1 on each limb, that gives you 4, and then 6 across the chest. Those are called the precordial leads. And they got to stick to the body, of course. And if people are hairy, or if they're sweaty, or they're moving, or they have lotion, it makes that whole process challenging. And very often you find nurses having to sit there and hold the electrodes in place, or use razors to remove skin, or take alcohol to remove the oils, or use sandbags to keep them in place. All this kind of just trying to make it work. Then you get to the wires, you attach these wires in the correct order. It's not arbitrary where one wire gets connected to each one of these 10 electrodes, and the order is very specific, and very often in the haste of the moment, we get them reversed. And I would just ask myself, is this really as good as it gets? Can't we do something better?